Hi, I'm Dr. Mike Joyner, and I'm an anesthesiologist and physiologist at the Mayo Clinic. The title of our paper is The Syntax of Sin Taxes, Putting It Together to Improve Physical, Social, and Fiscal Health. In our paper in the Mayo Clinic Proceedings, we raised the possibility that so-called sin taxes might be useful in addressing the country's long-term fiscal conditions. Most importantly, we are interested in whether these will also evoke behavioral changes which will reduce healthcare costs and improve the health of the nation. We talk about a number of specific items or behaviors that might be subject to sin taxes. The obvious ones are smoking and alcohol consumption. We also discuss high-fat foods and sugary drinks. A couple of interesting things to think about are the impact of sin taxes on behaviors like smoking and drinking. It's pretty clear that a modest increase in cigarette prices has a dramatic effect on consumption, and efforts to curb smoking through smoking bans and other legislation have dramatic effects on things like emergency room admissions for heart attack. And in fact, some of these things start as soon as a few weeks after the legislative changes are made. There's also some recent evidence that just having a minimal price for alcohol reduces the healthcare costs associated with alcohol consumption, most notably accidents, and some of the, quote, bad behavior, unquote, that happens when people have too much to drink. It's also interesting to note that the alcohol tax as a percent of the total cost of the alcohol is at its lowest level in many, many years. Historically, the tax has been about 25 to up to 50% of the cost of the alcohol, and it's much, much lower than that now. Historically, people should also realize that before the advent of the income tax, alcohol taxes made up about 30 or 40% of the revenue generated by the federal government. So historically, they were a very, very big part of how the government financed itself. Another interesting thing to think about is who will be affected by these taxes. There's all sorts of evidence that young people are especially subject to this type of behavioral taxing and do in fact change their behavior and don't engage in some of these activities. So for traditional things like smoking and drinking, sin taxes have a long history. They've raised an awful lot of money, and most importantly, they've changed people's behavior. There's also evidence that happens if you have a so-called fat tax or a so-called sugar tax, and in addition to raising money, those may be some of the most effective things you can possibly do to improve people's health and address the current kind of worldwide, or at least nationwide, epidemic of obesity. Now, the criticism, of course, is that you're engaging in kind of controlling behavior and generating what some people have described as the nanny state. But I think people need to recognize a couple of things. The taxes we propose are much, much smaller than the social costs of these activities. And two, the so-called nanny state works. Time and time again, when taxes that try to change people's behavior are implemented, they work and they have dramatic effects on public health. So who will be affected by these taxes? There's a lot of evidence that sin taxes are especially effective in curbing or controlling or helping young people engage in perhaps better behavior, and that can have very, very lifelong consequences for their health and for the country's health. So there are a couple of take-home messages with our commentary. The first is that you can raise an awful lot of money using sin taxes, and that sin taxes have historically been used to raise revenue for the federal government. The second take-home message is that these have very powerful effects on behavior and will in fact improve the health of the country. And the third take-home message is that while you can say we're engaging or advocating for the nanny state, in reality the taxes we propose are a very, very small fraction of the social cost of these behaviors.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.